Patellar tendinitis is a musculoskeletal condition. Look at this picture shows that knee joint, patellar tendon, X-ray findings. Look at this. Ultrasound, longitudinal view, normal patellar tendon and patellar tendinitis. Then MRI findings. Look at this. A detail going on. Introduction. Patellar tendinitis, commonly referred to as jumper's knee, is a condition characterized by inflammation or degeneration of the patellar tendon, which connects the knee cup patella to the shin bone tibia. This condition is prevalent among athletes who engage in sports requiring frequent jumping, running, or abrupt changes in direction. Proper understanding and management of patellar tendinitis are essential to prevent progression to chronic conditions. Definition: patellar tendinitis is an overuse injury of the patellar tendon leading to pain, tenderness, and functional impairment in the knee. It occurs due to a repetitive stress that exceeds the tendon's capacity for repair and adaptation, resulting in micro tears and inflammation. Etymology: the term patellar tendinitis derived from the Latin word patella, meaning knee cup, and Greek suffix itis, indicating inflammation, though the condition often involves degeneration rather than the true inflammation. Types: patellar tendinitis is often categorized based on the stage of severity. 1. Reactive tendinopathy. Initial stage with acute inflammation and swelling. 2. Tendon disrepair. Progression to structural changes and thickening of the tendon. 3. Degenerative tendinopathy. Chronic stage with significant damage and potential for tendon rupture. Causes: 1. Overuse from repetitive jumping or running. 2. Sudden increases in physical activity or intensity. 3. Poor biomechanics such as improper running or jumping techniques. 4. Weak quadriceps or hamstring muscles. 5. Inadequate warm up or stretching routines. Risk factors. 1. Sports involvement. High impact sports like basketball, volleyball, and soccer. 2. Age. Most common in active individuals age 16 to 40. 3. Body weight. Excess weight places additional stress on the knee. 4. Footwear. Inadequate or armored shoes. 5. Pre-existing conditions. Conditions like flat feet or patellar maltracking. Complications. 1. Chronic pain and discomfort. 2. Tendon rupture requiring surgical intervention. 3. Reduced mobility and functional capacity. 4. Psychological effects like frustration or depression due to prolonged recovery. Pathophysiology. The patellar tendon undergoes repetitive tensile stress during physical activity. When the repair process fails to keep pace with micro trauma, this leads to 1. Collagen fiber disruption resulting in weakened structural integrity. 2. Inflammatory mediators release of cytokines causing pain and swelling. 3. Neovascularization abnormal blood vessel formation. Exacerbating pain. Patellar tendinitis, commonly referred to as jumper knee, is a overuse injury that affects the patellar tendon, which connects the patella to the tibia. Below is step-by-step outline of its pathophysiology. 1. Excessive load and overuse. 2. Cellular and structural changes. 3. Vascular changes. 4. Inflammatory response, acute pace. 5. Chronic tendinopathy development. 6. Neural mechanisms of pain. 7. Failed healing response. The tendon fails to heal adequately due to repeated trauma, poor blood supply, mechanical overloading, scar tissues, and fibrotic changes can further weaken the tendon structure. This process underscores the importance of addressing early symptoms of patellar tendinitis through rest, rehabilitation, and load management to prevent progression to chronic tendinopathy. Signs and symptoms. 1. Anterior knee pain localized below the patella. 2. Swelling and tenderness along the tendon. 3. Pain aggravated by jumping, squatting, or climbing stairs. 4. Stiffness, especially after prolonged period of inactivity. 5. Weakness or instability in the affected knee. A diagnosis. 1. Clinical examination. A. Palpitation to identify tenderness. B. Assessment of knee range of motion and strength. 2. Imaging. A. Ultrasound to detect tendon thickening or tears. B. X-ray knee joint. C. MRI for detailed visualization of tendon pathology. 3. Functional tests. Pain elicited during activities like squatting or jumping. Nursing diagnosis. 1. Impaired physical mobility related to knee pain. 2. Acute pain associated with inflammation of the patellar tendon. 3. Risk for activity intolerance due to discomfort. 4. Knowledge deficit regarding conditions and self-care. Management. Medical management. 1. Medications. Non-steroidal anti-inflammatory drugs NSAIDs for pain and inflammation. Corticosteroid injection for severe cases. 2. Physical therapy. Strengthening and stretching exercises for the quadriceps and hamstrings. Eccentric training to improve tendon resilience. 3. Procedures. Platelet-rich plasma therapy. Surgical intervention in cases of tendon rupture. Nursing management. 1. Educate the patient about activity. 2. Modification to avoid aggravating symptoms. 3. Apply ice packs to reduce inflammation and pain. 4. Support compliance with prescribed physical therapy. 5. Encourage proper nutrition for tissue repair. 6. Monitor for adverse effects of medications. Treatment options. 1. Reset and activity modification. Avoid activities that exacerbate symptoms. 2. Physical therapy focused on strengthening and flexibility. 3. Orthotic devices, knee braces or patellar straps to reduce strain. 4. Surgical repair reserved for chronic cases with significant structural damage. 5. Alternative therapies, shock wave therapy to stimulate healing. Psychosocial medicine. 1. Cognitive behavioral therapy CBT to address frustration and anxiety. 2. Support groups, connecting with others facing similar challenges. 3. Stress management techniques such as mindfulness or medication. 4. Patient education, enhancing understanding of the condition and recovery. 5. Goal setting, motivating adherence to rehabilitation plan. Prevention: 1. Warm up adequately before physical activity. 2. Strengthen surrounding muscles to support the knee joint. 3. Gradually increase the intensity of training. 4. Use proper footwear and replace warm out shoes regularly. 5. Incorporate rest period to prevent over injuries. In conclusion, patellar tendinitis is a common but manageable condition that affects active individuals. Early diagnosis and appropriate management can lead to full recovery, allowing individuals to resume their activities. Comprehensive care, including medical, nursing, and psychosocial interventions, is essential to address the physical and emotional aspects of this condition. Thank you. Have a nice day.